Guys, and welcome to the ASL camp. My name is Dr. Luanne Sailors, and yeah, I'm just happy that you guys are here today to learn more about signs in the medical and health field. And so I have some things to cover today, so this session will be recorded, and I will be emailing you guys a recording of this session. We are going to stay on mute as we go through the camp today, just to reduce some sound so that we don't distract others as well. But if you want to talk or ask a question or anything like that, feel free to unmute yourself so that we can have a discussion about whatever your questions that you have. So just wanted to cover a little bit of that. And so some of my background is that most of you guys that follow me on social media, you already know that my parents are deaf, and that's how I learned sign language. And through the years, was a sign language interpreter for over 10 years and began working in special education and helped students with disabilities and learning needs. And that's how I began Sign Tribe. I kind of put those things together to help families be able to communicate better through sign language whenever there was a need for that. And so again, I'm so glad you guys are here today. We are going to start with just a few tips. So whenever you are confronted or whenever you meet someone that uses sign language to communicate, remember that not all people who are deaf or hard of hearing use sign. They may want to write on paper back and forth. So feel free to ask them, like, do you want to, sign? Do you want to write on paper? Like that, just to make sure that you meet their needs as a patient, okay? And so let's see. Oh yeah, and another tip is that I wanted to share with you is that whenever you feel like you don't know the sign for a word, whenever in doubt, make sure you finger spell, because you want to make sure that you get the right message across to the person. And then that leads into my third tip or third point before we get started learning signs, is that an ASL interpreter is required by the ADA regulations and rules, that whenever you are like an emergency situation or somewhere where you have to use sign immediately, then yeah, go ahead and do what you can and then call for an interpreter to be there to best interpret and sign to the person as needed, okay? So some of the first things we're going to start off with are just the basics. So if you can master the basics, then you can communicate almost anything in sign language. So I would suggest mastering the alphabet and then some of the numbers as well, because you might use some of the numbers as you are giving, blood pressure numbers or asking them how they're feeling, 1 to 10, things like that. So let's start off with the alphabet, okay? A. So your thumb's going to be touching your hand like this. A. B. Your fingers are closed and your thumb is tucked like this. C. D. So all your fingers closed together and just your pointer up. E. All right, so for E, sometimes you might see E a little bit more loose like this or like this. This is the proper way to do E. Sometimes it's difficult for people to scrunch their fingers or things like that. So I wanted to show you that you might see that variation when signing E. Okay. F, thumb and pointer together with the other 3 sticking up. G, thumb and index finger. H, all your fingers are together in a fist with your middle finger and pointer finger out. I, pinky, J, K, L, thumb and index, M, 3 fingers over the thumb, N, 2 fingers over the thumb, O, P, and we'll go through the alphabet again. Q, with thumb and index finger pointing down, R, S, make a fist, T, U, V, and then for W, bring up that ring finger, X, Y with your thumb and pinky, and Z. Just draw a Z in the air. So for the alphabet, if you can, memorize or master the alphabet, when in doubt, if you forget a sign, you're going to want to rely on that alphabet. So make sure that you memorize or master that as well. A, B, good. C, D, good. E, F, G, H, I, J, good. K, L, M, N, O, good. P, Q, R, S, T, U, V, W, X, Y, and Z. Good job. Clapping and sign language, right? So the reason why we do this is because if you can't hear the claps, then we do this for clapping and sign language. It's more of a visual thing. So again, we want to master the alphabet. Just in case you are in doubt with a sign, you can use that to fingerspell out specific words or phrases, and then as well as some of the numbers. You might want to use numbers for like blood pressure or how are you feeling, 1 to 10, things like that. So let's practice the numbers 1 through 10 and make sure we at least have those down. There are specific signs for numbers like 21, 22, 23. There's different signs for bigger numbers, but if you can, memorize and master, just like with the alphabet, the numbers 1 through 10, then you'll always be right if you got those right. All right, 1, 2, 3, 4, 5, and then turn your hand, 6, and you'll just go straight down, 7, 8, 9, and 10. Yep, good job. 1, 2, 3, good. 4, 5, 6, 7, 8, 9, and 10. So for 10, yep, you just make an A and twist, 10. All right, so we're going to move on to some phrases that I wrote down for, you guys have requested a lot of phrases and I came up with some as well. And we all are going to be learning a lot of vocabulary words. Don't get overwhelmed because it is going to be recorded, so you can go back and watch it again whenever you would like to practice or review any of the signs or phrases as well. So whenever we think about blood pressure, you're going to give 2 numbers. So if you are signing like 180, 180, the sign for 100 is 100. So you can do 180 and then just draw like a slash over. Actually, that's really high. I was thinking, we'll just practice. 180 over 50, just for an example. That's bad, horrible. That's why I'm not a nurse. So whenever you give the blood pressure number, you can just do 180, or if you know 180, and then just do the slash, like you're drawing a slash, and then the number on the bottom, 50, or whatever the number might be, okay? That's very high. So you make a H, high, low, make an L, and then push down, low, high, low. And so if you had somebody that had that high blood pressure, your face would be like concerned, right? High. So you can pair that with trying to show them that it's a high number, it's bad, with your face. Be like, high blood pressure. So you would just put your hand over your arm like a cuff and just squeeze, blood pressure, high. Okay, so make sure you don't forget the facial expressions too, because a lot with ASL, it's about facial expressions and body language, and that can help you to communicate the message as well. All right, so just use the slash with the two numbers for the blood pressure. All right, so whenever we are talking about pronouns, so talking about another person, over there, over there, over there, for he and she, you would just point with your finger. So if you have a, a person over there, you're like, that person over there with you. So you can just point, person, with you, with, make two A's, and then you're going to touch them together, with. Notice how my face became like a questioning. So make sure you don't forget that. So you don't have to know like the person's name. You can just point to whoever you're talking about, or the person that you're talking to in sign language, they might point to someone. They are with me, yes, okay. And then let's go over the question words as well. Who, so who is an L, touching your chin with your thumb, who, or who. You might also see who like this, depending on your region. Who, 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 who. What? So your hands will just be facing up and just go back and forth. What? Or what? With your left hand and a 5. If you're right-handed, then you're always going to use your right hand to lead the sign. So my right hand is going to move across my left hand. So with your pointer finger, just go down like this on your hand. What? So what or what? When? When did it happen? Happen when? With your pointer fingers, with your right hand, you're going to just kind of circle and touch. I've also seen where it's just more of a smaller movement like this, when. So you can do that. When, where. With your pointer finger, just shake it. Where. Happen. So with happen, your index fingers, you're just going to go down and out. Happen where. Why. So you're going to touch your forehead with these 3 fingers that are in the middle. And then as you're coming out, you're going to transition to the letter Y. Why? Why? Or you can also leave your hand up here and just move these 3 fingers up and down like this. Why? Seen that as well. And for what? Or like what for? Okay. With your index finger, for what? Or what for? Or for what? You can use this. Okay, just go back and forth. What for? So in ASL, if you're using the appropriate, grammar structure, then the question words will always go at the end. But in an emergency situation, I wouldn't be too worried about, grammar structure. It's just about making sure that you know what's going on, what's happening. Happen. Happening. What are things that happened? Okay. You might ask them, are you deaf? So deaf, you might need to know. And just because somebody is deaf doesn't mean that they can't hear anything. So some people that are deaf have, it's a different, ranges, variation of levels of hearing. So they might be, able to hear very loud sounds or things like that. So that doesn't mean they're just completely not able to hear anything. So you can just ask them, like, are you deaf? You need sign? You need interpreter? Okay. You deaf? Here, point your finger, mouth to ear or ear to mouth. Either way is fine. Okay. Do you understand sign? Like I said earlier, some people that are deaf or hard of hearing may not use sign language. They may just be completely oral and rely more on lip reading, or if they have a cochlear implant, they may use that to assist them when communicating as well. So understand. So you're going to have a fist and then pop your index finger up, understand. Sign. With your index fingers, rotate towards your body. Understand sign or understand ASL. Okay. I've also seen the word sign like this. So this is the sign for many, a lot. But if I just open and close quickly, signs. Okay. Sign, sign. Understand. So there's some variations when asking, do you understand signs or sign language? All right. Your name is what? What is your name? Your name, what? Name, make 2 U's and your right hand will touch the top of your left. Name. And then you can introduce yourself. My name, and then just spell your name with the letters. Because whenever you meet a patient, you're going to say, hi, my name is, and then spell it, right? And then you'll also have, like you might have the name written down on the board too. So you might, for some hospitals, I've seen that before, where their name of the nurse is on the board. So you can say like, hi, my name, and then spell your name, and then point to the board so they can see the spelling too, as well, if they need that support. Need, ask, interpreter. So do you need an interpreter? Need, make an X and up and down. Need, ask or request. Ask, so your hands are in a closed 5, and then come towards your body like in a praying hand position. Ask, interpreter. So this is the sign for interpreting, okay, or translating. So make 2 F's, and then my right hand is moving back and forth like this. And then when I do this, this is the marker for person. So interpreting, person, interpreter. Need, ask, interpreter. You need, you want, hands open and then close into a claw as you move towards your body. You want, interpreter. Okay. So they might say yes. So make a fist, yes. And then no, make a closed 3, and then up and down, no. Now you might also have seen this sign before. This is duck. And then when you have it outside next to your body, this is no. So don't get those confused. You'll also notice that a lot of signs look alike, but they're different. Duck and no. Okay. Feel, like how are you feeling? Okay, if you wanted to say each word, you would say how, with hands pointed down, rotate towards your body, how, or how like this, with two A's, and then my right hand is shifting back and forth like this. How you, just point, feel. How are you feeling? Or you can just point to the person and say, you feel, with a questioning look on your face. So feel or feeling, you use the middle finger and just swipe up on your chest a few times. Feel, feeling, you feel. Go ahead.
So would this, would it also mean like feeling, but just a different sign for the same thing? Or would it be feeling and then a different context?
Let me see the sign again that you were showing me.
So one up here and then one on the stomach.
Okay, so whenever people sign it like that, I'm gonna move my hand up a little bit, but this is concern.
Just like at the same time.
This is sick. Yeah, I haven't seen this for feeling with two hands. Maybe where you're from, like your region, they might use that. Certainly, if y'all use that in your region, you can use that. But we like feeling like this.
Mm-hmm.
And then concerned is when you tap back and forth, left to right, alternating. And then this is sick. So if you touch your forehead and your stomach at the same time, that's sick.
Yep.
Yeah. Yeah, you're welcome. Feeling. So you might also ask them like, on a scale from 1 to 10, how you have sometimes like the numbers on the board, 1 to 10, or you might ask them 1 to 10, what do you feel? So 1, and then do like a dash. 10, you feel, okay. Or a lot of times now, I think they have like the faces on the board, or you have like faces on paper with like smile and, the different faces. So you can just ask them, you feel, and then show them the paper as well. So you can use the word feel and point, or feel and show them the paper or anything like that. Okay. So sign language is a lot about expression. So if you just use the word feel and point and then use your face like you're asking them, how do you feel? That's all you really need to do. So you don't have to worry about how do you feel unless you want to, that's fine. Or you can just do feel to try to figure out how they're feeling. Hurt or pain. Feel hurt, pain. So use your index fingers. You can twist, kind of go toward each other like this. Pain, hurt. Okay. If you do it by your head, that's headache, headache. If their shoulder was hurt, 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 pain. So wherever the body part is that they're pointing to, or that you point to and say, you're basically asking, is your shoulder hurting? So you can use this sign for hurt or pain around or above any body part to ask them if that specific place is hurting. Why here? Or you here? Why? Or what for? So why are you here today? You here. So have closed fives and just go back and forth and just shake like this. You here? You here? Why? Why? You here? What for? And at any time, if you don't understand what the other person is signing to you, you can ask them to sign slow, sign slow, or sign again, sign again. So again is your right hand in a bent shape, fingers pointing up, and then come across and touch your left hand in the middle. Again. Okay. Or you can ask them, please write. So if you want to understand clearly, you can ask them to write. So if my left hand is flat and a closed 5, right hand, I just use my thumb and pointer together and just write. Now, right back and forth, you'll just do that motions and then move your hands back and forth, like you write, I write, you write, I write, okay? You can do that too. So what medicine do you take? Medicine. So this is a sign for medicine or medical. Okay, with your middle finger of your right hand, touch the palm of your left and just go shake back and forth. Medicine, you take. So you'll just use your thumb and point your finger and just flick towards your mouth. Pills, or that you take. What? What medicine do you take? And then they might finger spell it, write it down. They might have the bag with them of the medicine bottles there, okay? Do you have heart problems? Okay, heart, with your middle finger, touch your heart, heart, problems. So make 2s on both hands and bend them. And then you're going to just go back and forth like this. Heart, problems, and then point to the person. Or do you have heart problems? You have. So your hands are going to be in closed 5s and just touch your chest. You have heart problem. So if you wanted to ask them if they had the problem before, like before, in the past, you can just do this, past or before. So you would have your hand in a closed 5, before, now, make 2 Ys and pull down, now. But if I do this, this can be today, okay? All right, now, today, before or in the past, will or in the future. So instead of going back, you just go forward. Will or in the future. So today, today, or now, day, today, now, day, and then tomorrow. Make an A, touch your cheek, and twist out, tomorrow. So you might tell them, tomorrow, you home. Home, tomorrow. So home is like the and sign. You just have your fingers all together touching your thumb, side of your mouth to your ear area. Home. You're going home tomorrow. Are you excited? Excited. With your middle fingers up and alternate right to left. Excited? Home? All right, so we already went over yes, no, and now we're going to get into the vocabulary words. All right, health, health, heal, to get well, healthy. You can use this sign for all those words. So well-being, health. So your hands are open near your shoulder and chest, and as you come out, make a fist. Health, healing, to get well. You might also see health or healthy with H's. Start up here and then go down to your stomach. Health. Health. Allergies or allergic. So you might say you allergy medicine, you allergy food. All right, allergy or allergic. Touch your nose, and then your fingers will touch each other and then move apart. Allergy, you, allergy, medicine, U, allergic or allergy foods or eat. Those might be important to know if they're, especially if they're staying in the hospital and eating there as well. Ambulance. So think about the lights on top of the ambulance. So your hands are going to be in claws pointing up and just twist like this. Ambulance, ambulance. Asthma. Okay, so this is breathe, normal. So your hands are in fives. Right hand is on top, left on bottom, and just go up and down. Breathe, breathe. Now, if you wanted to ask them, do you have asthma? Or are you having asthma attack? You would just go like faster like this. Breathe, attack. So like the, it hits you, right? So left hand with your pointer finger, right hand is going to be open. And as you come closer, you're going to hit it like you're punching something, right? Attack, hit. This is also like hit, like something hit your arm, you know, something like that. You can use that hit for that too. So breathe. If I go faster, that might be like an asthma attack. Or you have, and then spell ASTHMA. Okay, to make sure it's clear that they know you're asking, do you have asthma? Okay. Band-Aid, yes, go ahead.
So with that,
Yes.
how would you ask if they're like short of breath, like breath or
Oh, you could say, yeah, problem, breathe, and then just act it out. Like, that's what I would do to help show the message. It might feel strange at first to, with all the facial expressions and like acting and things like that. Some people feel like it's strange or whatever, but if you can do that, that will really help.
Yeah. And then you might be able to like explain like short of breath. So SOB. And then
yeah, so if you want to use SOB like that for short, for breath like that, you can spell short or like little, hard, like that, and show them that you're going to use that abbreviation for short of breath. Yes, you can do that. Or you can write down short of breath and then point to that word and do SOB like that to show them that you're going to use that abbreviation for short of breath. So short can also be this, short, but this is almost like shortly, like I'll be there shortly. I guess like an emergency, if you want to be short of breath, you can, but this is more short, like soon, like we'll be there soon, shortly. Okay.
And given context, they'll probably understand.
Yes. Yeah, especially in an emergency, you know, I feel like it's just different, you know. Yeah, for sure. All right, so Band-Aid, so make 2 U's, and then right hand will just come across the top. Band-Aid, Band-Aid. Now for bandage, you're just going to pretend like you're wrapping your arm or something. Bandage. So if you say arm, wrap. Yep. Just pretend like you're wrapping the arm with the bandage. Broke. So broken or broke, have 2 fists together and then come apart. Broke, broken, bone, bone. So you're going to make 2's, bend them, bone. Do you have a broken bone? Or you might tell them, you have the broken arm, the bone. Need. Let's see, cold and cough. Cold. So you're going to just, yep, do like this. with your fingers like this, cold. And then cough with the fist. You can do this and go on your chest, cough, cough. I've also seen this where you make a C and put on there cough. But mostly I see this, cough. Okay. Cut, cut. So if they have a cut on their arm, cut, or anywhere. Cut, 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 cut. Okay. Pills. So what pills do you take? We did that, pills. Medicine. Cream. So it's like kind of like lotion. You just pretend like you're rubbing the cream on your skin. And then prescription, RX. So prescription, we just do RX. Dizzy or confused, dizzy. Two hands, just go around in circles. Dizzy, you feel dizzy, feel weak, weak. Yeah, go ahead.
So a lot of times if they're asking if you're dizzy, they'll also ask if you're confused. So how would you like differentiate those?
So the way that I would also say it with my mouth,
Okay.
feel dizzy, feel confused. Okay, dizzy.
You also like kind of like show it with your hands. Yeah.
Yes, so you feel, yeah, you can do that too. I usually use confused more like down here, confused, like when you're looking at something, it's like not clear to you, feel, it's more like your head, or, and then you can say, feel dizzy, feel, okay. Yeah, good. So there are many ways you can ask if they feel unstable, dizzy, or not normal, like that. Yes. Oh, emergency, make two E's. Emergency. Emergency room, ER. Fever. So you're going to put the back of your hand on your forehead. Fever. Now, temperature is with your left hand with the pointer finger, and right hand, you're going to come right here behind it and just go like this. Temperature, up and down. Temperature. And then you can do the numbers like 100, 100, temperature 98. So it's where the 1 through 10 comes in handy. 98, temperature 104, high. Okay, the H, high. And then temperature 74, low, dead. Dead. So your right hand will be facing down, left hand up, and then you just alternate. Dead, dying, death. Yeah. Alive, survive, live. You would use an A on your chest and just swipe up for all those types of signs, like live, survive. Flu. So flu, you just spell FLU. And then something that's more relevant now that people have asked about how to sign is the coronavirus. So I've seen different signs, COVID-19, so COVID, 19. So you make a 9 and twist, 19. Or you might start off with an kind of like an A shape on top of your left hand and then open as you swipe. Or I've just seen it like this. So I've seen many different ways or things about how people sign COVID-19. Infection, make an I and shake your hand. Infection. Inhaler, so you just pretend like you're using an inhaler. So if they say, yes, I have Asthma, you might ask, you have medicine? Have? Okay. Nauseous, so you're going to use a claw on your stomach and just go around. It's hard to see, but just touch your stomach and go around in a circle like your stomach's in knots. You're nauseous. Yes, question. Go
So
ahead.
with the inhaler one,
Yes.
for EpiPen, can you do like allergy, like shot or
Yeah,
whichever?
yeah, like allergy, like this, because EpiPen's more like you stab yourself. Yeah, so I would do, and I would even EPI, you have allergies, maybe at least do the EPI so they
Yeah.
don't confuse that with shot. Hmm. Yeah, because some people get allergy shots, but they don't have the EpiPen, Epi. Mhm. So yeah, you can use that too, like shot, like the EpiPen, EPI you have for allergies. You can do that. So we did nauseous. So with the claw on your stomach, just go around, nauseous. Vomit with your face. Just make fives. The right hand is closer to you and just go out like this. And then we did high and low. H, go up, low, go down. Sick, sick with your middle fingers, forehead and stomach. Sick, sick. Hospital. So make a U, go across, and then up top to bottom like a cross on your arm. Hospital. Doctor. So for doctor, there are variations. So my left arm is out like this, and my right hand, I'm going to make a bent shape and then touch your wrist. Doctor. Doctor. Or I've seen a D, doctor. Nurse. Make a U and then touch your wrist. Nurse. And this is like if you're taking a pulse and things like that, that's where that comes from. Nurse. Doctor. Nurse. Somebody might ask you, yes, no, are you a nurse? Help. So for help, your left hand's going to be flat, right hand make an A, and then pull up like this. Help. Need with an X, up and down. Need help. And then point to the person. Or you can sign help and move toward the person. Help. Do you need help? Whenever you sign help and move towards somebody, you're implying that you're asking, do you need help? And then help me if you need help. Blood pressure, you're going to just act like you're, have like the cuff around your arm, or blood, red, and then trickle down, blood, or bleeding, blood, pressure. Left hand, make a fist, right hand a 5, put it on top and just press up and down like you're pressing, it's pressure. Blood, pressure. Now for a CT scan or MRI, you can spell CT and MRI, and you can also do this. So it's like your left hand is a C pointed down, and then your right hand make a U as if it's the person's body going in to the scanner. Yep. So like this can be used for CT or MRI. So you might do like this. You need MRI, or you go, or go. Now signing is toward your body, Go is away, like you're moving away. Go. You need go. CT now, today.
So with that, like say they need a wheelchair, would you like
Wheelchair.
okay.
You need wheelchair. So you just pretend like you're wheeling a chair. Wheelchair. Wheelchair. So like a walker, you just pretend like you're holding a walker and moving it. Crutches, you just pretend like you have the crutch here. Do that. Yes. Now, later, later. So they might ask you, or they might say, need more medicine. And then you might say, later, later, medicine, more. Waiting room, wait. With your hands in fives, your right hand is closer to you. Just wiggle, wait, wait. And then waiting room, wait, room. So you're going to essentially make a box with your hands. This is my left hand, and then my right hand's closer. Room. So they're in front of each other, then across. Room. Wait, room. Let's see. Good. Left hand's flat, right hand, touch my chin, and then come down. Good. And then bad is you're going to turn your hand and slap your hand like as if you're clapping. Good. Bad. Oxygen. Make a O and just kind of shake it a little bit. Oxygen. You might say oxygen and then do like the little plugs, you know, that go in your nose or something like that. So just like pretend like you're putting one on and then O, followed by the O, oxygen. All right, so for your organs and body parts, like your arm, leg, things like that, you're basically just going to either point or like your arm, leg, you can touch your leg or tap it or move your arm, your hand down your leg. Head, so your hand's going to be a closed five. Head, touch your chin to your forehead. Head, like ears, eyes, nose, mouth. Now, for your body organs, heart. Yep, middle finger touching your heart, heart. Lungs, so your hands bent, lungs. A lot of times it's better to, when you sign the body organ and then spell L-U-N-G, lung, and then do this. And then from then on, you can do this and that will mean lung. Just with the medical stuff, you just want to be sure it's clear. So lung, L-U-N-G. Stomach, so your hand will be bent and just kind of do that like in the middle right here, like where the bottom of your stomach is, stomach. And then same thing like for kidneys, liver, kind of in the area of where those organs are, you'll use that bent hand and just point, you know, touch it and then spell kidney, liver, things like that. So a lot of body parts is just touching or pointing and then clarifying with spelling. Okay. Any questions about that?
How would you do your back or your spine?
Oh, yeah. Back. Yeah. You just touch your back. And then you can, for your spine, you can do like back. And then like, you know, like your spine bones, back, bones. So you're actually just showing an image, you know, a made up image of the spinal cord or the bones back there. So the back set of bones. What you could do for the spinal. And then you can spell S-P-I-N-E as well if you needed to be more specific. And then of course, like your L7, like the different numbers, you would just combine that with the letter and number, like L4, L7, like that, if you needed to. Shot or vaccine, shot. So just make a 3 and your thumb is going to go in between, kind of like a K, and then just press down, shot. IV, so you can spell IV, or with your pointer finger, you just, you know, act like you're putting in the IV here or here. There's different places you can have the IV. You can also, like if you are giving an IV for medicine, like make a 4 and it's going to come into your arm. Medicine. Okay. Let's see, bathroom. These are more functional. Bathroom. Eat. Make an and sign. Eat. Sleep. Your hand is going to be open in front of your face, and as you move straight down, your hand's closed. Sleep. Sleep. Rest. So if they need to rest, your hands are crossed. Rest. Sit. Make U's, and your right hand will go on top. Sit. Now, if you wanted them to come up in the bed, like if they're laying down, lay down. So make a U and just lay down, like as if a person's laying down. Lay down, lay down. So if they're laying down, you might kind of with your arms, like you need up, up, or up. Use the person, like this is, you're pretending like this is the person, a classifier. So they're laying down, and then you might do this, like you need, and then maybe give them the remote to move up, or get the remote yourself and say like me, I'm going to press the button to move you up. Okay. Get up. Yeah, so get up or get out of bed. So have your 2 pointed up and then move and touch like you're standing. Get up. Up. And they might want you to walk. So there's different signs for walk. You can do this, walk. Walk like this. You might see a 3 upside down, walk. Walk like this with 5 closed 5s and alternate, walk. Okay. Walk with 3s, walk. So there's many different signs, but probably the easiest one is this, walk. You need, get up and walk. Practice. With an A touching your pointer finger, go back and forth, practice. Yeah. See, all right. So are you all right? Okay. So all right. So with your right hand, make a closed 5 and swipe up. All right. Or okay. There you go. All right. So those were all, there was a lot of words that I taught today. So don't feel overwhelmed with the words or phrases. This, was recorded, and I will email you the video to everyone who registered for the camp today, so that you can go back and practice and learn more. So what other sentences or words do you want or need to know in relation to this topic? Anybody?
So a lot of times, call light. How would you sign that? Like help light or
Oh, okay.
like call
So
button?
call, like call me, call. So your left hand flat, right hand, you're going to just have it in a bent and swipe, and it's going to almost come back into an A. Call me light, light. With your thumb and middle finger, light. And then you would have the button or whatever that is and point to it, or if it's like a movable one, get it and show them this, call me.
Okay.
You need help, call me, like that. So a lot of what you'll find is a lot of it's going to be just pointing or using the actual objects and point to that and then explain like what's happening or what they do with that. Yep. You have more? Go ahead.
Kind of. A lot of them are more like specific on my unit and whatnot, but like, let's see. I don't know. I feel like my vocabulary for that is more.
Go ahead.
Yes, but
If you have any questions, go ahead.
like for blood draws, so blood like tape.
Yeah. So you can do red blood, red bleed, like you're taking it out.
Okay.
Raw blood. Sometimes you can just do this and they'll know that you're talking about drawing blood. If you do that, you're like this, like draw blood now, and they're like confused, then you can be like bleed or blood, you know, like, yeah, need blood, test. Yes. So I've seen test like where it's your point your fingers like down, down, and then like this, or like question marks and then flat. Test, test, evaluate, make ease, up and down, evaluation, need, look. So doctor, doctor, look, evaluate, X-ray, X-R-A-Y. You would spell X-ray. Doctor, need, evaluate, X-ray. So that's a good one. Yeah, evaluate, look, doctor. It's good.
Another one would be like weight.
Weight?
No,
Oh,
like
weight. Okay.
like
Yep.
your body weight.
Yep. Weight. So weigh or weight, make use. And it's just like, you know, name is like this. So with weigh, you just go up and down like this, like a scale, you know, being balanced. Weigh. Your what?
And then temperature, you could like if you're gonna take the temperature, you could.
Yeah, you can do your pointer finger like temperature or like yeah. So like the strip, so you can do that. Temperature. Yeah, you can do that as well.
Okay.
Anything else before we go?
No.
Okay. Well, I hope you found this today, the camp, to be helpful. I know it's a lot to learn in a short time, but I'll be sending that to you today or tomorrow. Okay?
Okay.
All right.
Thank you.
Well, I'll see you later. You're welcome. Bye.